Good morning. So I needed to practice my presentation for the Tri-State Craniofacial Conference that's a week from now, and I thought, what better place to do it than here and record it, and that way I can share this information with you guys after the conference. So for just a little bit of background, I live in Indiana, and I was invited to be on a panel for the Tri-State Craniofacial Conference, which is Indiana, Ohio, and Kentucky. And this panel is talking specifically about temporal mandibular joint replacement. So I have 5 to 7 minutes at the beginning of the panel presentation to give a summary of myself. So that's what this is. And then it's going to be followed by a 30-minute Q&A time. I will be sharing the stage with an oral maxillofacial surgeon and an orthodontist. So I'm going to go ahead and share my screen to my presentation. All right. So from here, I am going to act as if I am in this conference room and you guys can help me practice. So, good morning. My name is Tiffany Smith and I am actually a nurse here at Riley, but today I am here as a patient and I'm honored to share my story from fear to freedom, my journey before, during, and after TMJ replacement. In January of 2022, I found myself like this. What we had been doing for 16 years was no longer working anymore. I had been a patient since 2006 when I was 16 years old, when I got braces for the first time to correct my bite. But knowing what I know now, my asymmetry and misalignment actually started from a much earlier age. As you can see here, the progression through my childhood and into my adulthood. So in 2008, when I was 18 years old, I had jaw pain and headaches for about a year. I was referred to a specialist who did some imaging and diagnosed me with internal derangement of the TMJ and anterior disc displacement with loss of joint synergy. The treatment plan was a MORA, a maxillary orthopedic repositioning appliance, or a splint that I was to wear in my mouth for 6 months to a year. At that point, I would wean out of it, and the soft tissue in my face would hold my jaw in the correct position. At that appointment, my mom asked what would have caused these diagnoses. We were told there was no way to know for sure, but it was possibly trauma to my growth plate around the age of 5 years old. We decided to go through with the treatment plan. However, after honestly, it was closer to 2 to 3 years of trying, we were unable to wean out of the splint. Every time we tried, my pain skyrocketed, and my ability to function in my day-to-day life was super limited. At that time, the provider wanted to take the splint out of my mouth and do a full set of braces to realign my bite again. This plan really scared me. It felt super permanent and irreversible, and I wasn't sure how I would be able to tolerate taking the splint out permanently and putting in braces when I couldn't even handle it being out of my mouth for 30 minutes. So I sought a second opinion. This provider did imaging in 2015 when I was 25 years old. After reviewing my case, she told me that in the same way that a type 1 diabetic needs insulin, I may just need a splint in order to maintain my quality of life. This felt like a safer and less irreversible option. So for 7 years, I wore a splint in my mouth to help with my pain control and keep me doing the things that I love. This takes us to 2022, where I started this presentation. Things were no longer working. I thought I just needed another splint and that it had worn down to the point of being unsupportive in my mouth. However, my provider did imaging and noted the asymmetry in my condyles here. At that point, I was referred to Dr. Movahead in April of 2022. That is when I received the correct diagnosis of condylar hyperplasia, which is a bone tumor or an osteochondroma in my left mandible. And as my left side grew, it shifted my midline over towards the right, causing pressure in both joints, leading to arthritis and subsequent degeneration, which then led to the maxillary and mandibular asymmetry. The treatment was bilateral joint replacement and a three-piece Lefort. My assignment was to find an orthodontist to partner with my surgeon and get me ortho ready with braces. This proved to be much harder than we were expecting. I was very splint dependent to control my pain, and you can't wear a splint on your lower teeth and have braces at the same time. So for over a year, we attempted different alternatives to a splint to try to get braces on my lower teeth unsuccessfully. It was one of the hardest years of my life. My orthodontist, Dr. Davila, and my surgeon, Dr. Movahead, collaborated and came up with this life-saving option for me. This is a splint that was designed specifically for me, making me emotional thinking about it. And I would wear it in my mouth to support my bite while we were also able to do braces on my lower teeth to get myself ortho ready for the surgery. So, in September of 2024, 2.5 years after my consultation with Dr. Movahead, I had my life-changing surgery. At that point in my life, I hadn't chewed food in 2 years, and my pain had gotten so bad that I was having a hard time doing anything I enjoyed, let alone the things I had to do. These are some images from my virtual planning session. It was very helpful as a patient to see these and understand what was going to be happening in the surgery. So, in conclusion, there are 4 things that I feel super passionate about, and given the more time, would love to discuss them in detail. The first is the importance of the provider-patient relationship and how it supports hope and healing in this journey. Secondly, is the role of nutrition and how a no-chew and soft-chew foods don't have to be boring. Thirdly, is the value of prioritizing doing what you love, even if it has to be modified, and the importance of having providers that support you doing so. It does so much for your mental health and your coping during this journey. And lastly, the importance of collaboration with a multidisciplinary team and the role of holistic medicine and how it has been crucial to my healing. I want to thank you all so much for your time today and for listening to my story. Thank you for the work that you do for your patients and for being here today to hear. I've provided a QR code for my Facebook group, From Fear to Freedom, my journey before, during, and after TMJ replacement that I started at the very beginning of this journey, along with the QR code for my YouTube channel. And lastly, my work email provided there if you would like to reach out to discuss anything further. Thank you all so much for your time. All right, that's it. That is very challenging to capture everything in that short of amount of time, but I hope I did well and I hope it's meaningful to the participants at the conference. There are going to be a whole slew of different providers there. Obviously, oral maxillofacial surgeons, plastic surgeons, ENTs, dietitians, physical therapists, speech therapists, orthodontists, dentists, and then there's also going to be patients and patient families. It's an all-day conference. It is not recorded and there is no virtual option to attend, so I was very saddened to hear that. But I will try to take notes for you guys and I will do a video to summarize what I learned at the conference. So bye guys. Thank you so much for your time.